Annaliese Michel, born the 21st of September 1952, died the 1st of July 1976. The list of demons in her. This Lucifer. Hitler. Nero allegedly burned Rome. He was actually a good emperor. Judas, the ugly guy kissing the young one. Cain, as in Cain and Abel, the first murderer. Let's find out how a beautiful young lady gets herself into a possession and dies of malnourishment. It all starts with these two guys as Himmler proposes, and Hitler accepts the murder of psychiatric and epileptic patients.
The thefukufiles!
Neurologists got an abundance of brains to study, as more than 400,000 psychotic and neuro patients were murdered. But their effort was directed at identifying cases as evidence for the Nazi hereditary health courts. Neurologists and psychiatrists had to find a place in a system that didn't want to treat or cure, but to diagnose and kill. At this time, a rift existed in between the two branches, to separate neurologists and psychiatrists into different medical fields, both searching to be useful to the Nazis. A generation was raised with the idea that anything but perfection was acceptable from a German family. Why all this matters? Annaliese's parents grew in that Germany, and for them, a possession was way better than a psychiatric or neurological disease. And the same for Annaliese. Once medicines failed, she would have been committed to a psychiatric ward. 1970 Germany, jail was a better option. The standard treatment for epilepsy, electrical shock therapy, and in extreme cases, lobotomy, rendering a person a walking dead soulless body. No matter what, Annaliese's future was not a pretty one. All medical outcomes would have her committed and lobotomized, or worst, a sedated prisoner of a mental institution. Dr. Siegfried Luthi diagnosed Annaliese with tonic-clonic seizures, formerly known as grand mal seizures. EEG showed an irregular alpha pattern with some theta and delta waves. During a seizure, muscles unleash their full potential, which is about twice what you can achieve consciously. Some individuals experience an aura, a warning sensation that can include visual, auditory, or other sensory changes, or feelings of anxiety. During and after the episode, the individual will experience blue skin or lips due to breathing difficulties, teeth clenching, the jaw may clench tightly, foam or saliva may be present around the mouth, breathing may be labored or temporarily stop, changes in senses, vision, taste, smell, or other sensory changes occur. Annaliese had a physical affection that caused mental symptoms that include hallucinations and shifts in perception. But on top of that, she had a mental disorder. We are still missing the psychological diagnosis. But for this, we need to understand the side effects of her medicine so far. Side effects: confusion, involuntary eye movement, depression, suicidal thoughts, decreased coordination, shakiness in the legs, arms, hands, or feet, twitching, twisting, or uncontrolled repetitive movements of the tongue, lips, face, arms, or legs, uncontrolled twisting movements of the neck, trunk, arms, or legs, unusual facial expressions, trouble sleeping, confusion, insomnia, depersonalization, psychosis, emotional lability, personality disorder, hostility, amnesia, neurosis, euphoric mood. Pyrazine side effects include drowsiness, dizziness, lightheadedness, blurred vision, dry mouth, nausea, vomiting, constipation, diarrhea, and decreased interest in sex. Common carbamazepine side effects include drowsiness, dizziness, and trouble balancing. Digestive side effects, such as nausea, vomiting, and constipation, are also common. Serious carbamazepine side effects include suicidal behavior or thoughts, blood cell problems, and severe skin reactions. In 1970, not all was well understood about these medicines. On top of that, Annaliese had a good motivation not to disclose all her psychotic symptoms with doctors. She would have been committed to a psychiatric ward for sure, and that meant a life of torture and a lengthy, slow death. The psychiatric diagnosis: epileptic psychosis, bipolar disorder, maniac depression. Missing was schizophrenia. In 1970, epilepsy would have been addressed first, and only when cured, schizophrenia would enter the picture. Thus, the lack of antipsychotic medicine, which was what she probably needed from the start. Maybe if neurologist Dr. Siegfried Luthi had sought the input of a psychiatrist early on, maybe things would have been different. But the rift that started before World War II had just ended 5 years previous, with the recognition of neurology as a different branch from psychiatry. It would have been unlikely in 1974, such cooperation. Freud would have concurred the culprit, a misdiagnosis, and a patient that didn't relay to her doctor all her symptoms. But then again, in 1970 Germany, epilepsy and schizophrenia was a sentence to lose one's freedom, at worst, and socially ostracized at best. When doing this episode, an endocrinologist friend of mine pointed out that in all pictures he has seen of Annaliese, she appears to have hypothyroidism. In 1969, the thyroid gland was barely understood, compared to what we know now. As ridicule as it would sound to us, for her parents, all things considered, possession was a better diagnosis. No psychiatric ward, no electrical shocks, and a possible cure. For Anna, a sense of purpose in a cruel set of cards dealt to her by life. Then we have these guys. They offered a cure that ultimately led to death. Priest Ernest Alt had been diagnosed with mild psychosis. He wanted to believe, and so the Michel family. In 10 months they did 67 exorcisms. Never mind, Annaliese didn't meet the requirements for one. No unknown languages were spoken. No paranormal phenomena. No secret details about strangers' lives. Nothing but the hope for it to be true. Sometimes delusional hope can kill you. And most times, medicine is more scary than demons.
The Fuku Files!